Welcome to today's video about signs of autoimmune diseases. Your body is designed to protect you, but what happens when your own immune system turns against you and starts attacking your healthy cells? This isn't science fiction. This is the reality for millions of people living with autoimmune diseases. Right now, your body might be sending you warning signals that something is seriously wrong. And ignoring these signs could lead to irreversible damage to your organs, joints, and nervous system. Today, we're going to uncover 9 dangerous signs of autoimmune diseases that you absolutely need to know. These aren't just random symptoms. These are research-backed red flags that could save your life. By the end of this video, you'll understand what your body is trying to tell you and when it's time to take action. All right. Let's jump into the warning signs of autoimmune diseases, starting with number 1, unexplained chronic fatigue. Imagine waking up after a full night's sleep but feeling like you haven't slept at all. Your body feels heavy, your mind is foggy, and even simple tasks feel overwhelming. This isn't just regular tiredness, this is chronic fatigue, and it's one of the most common yet overlooked signs of autoimmune disease. Research shows that over 80% of people with autoimmune conditions experience this deep, persistent exhaustion. It's particularly prevalent in lupus and multiple sclerosis patients. But here's what makes this fatigue different from normal tiredness. No amount of rest makes it better. You could sleep for 12 hours and still feel drained. Your body is constantly fighting an internal battle, and that war is exhausting your energy reserves. The reason behind this relentless fatigue lies in chronic inflammation. When your immune system mistakenly attacks your own tissues, it releases inflammatory proteins called cytokines. These cytokines don't just cause inflammation, they also interfere with your body's energy production at the cellular level. Your mitochondria, the powerhouses of your cells, struggle to function properly under constant inflammatory stress. Studies published in the Journal of Clinical Investigation demonstrate that autoimmune-related inflammation disrupts normal metabolic processes, leading to profound energy depletion. If you're experiencing exhaustion that doesn't improve with rest, especially combined with other symptoms we're about to discuss, your body might be waving a red flag. Don't ignore it. This could be your first warning sign. Next, sign 2. Joint pain, swelling, and morning stiffness. Now, let's talk about your joints. Have you ever woken up with stiff, painful joints that take more than an hour to loosen up? This isn't just aging or sleeping in an awkward position. This is your immune system attacking the lining of your joints, and it's a hallmark sign of rheumatoid arthritis and psoriatic arthritis. Here's what's happening inside your body. Your immune system produces antibodies that target the synovium, the soft tissue lining your joints. This triggers inflammation, causing swelling, pain, and that characteristic morning stiffness that many people describe as feeling like their joints are frozen. Research published in Arthritis and Rheumatology confirms that this inflammation-driven process leads to cartilage and bone damage if left untreated. The scary part is that this damage can begin very early in the disease process, often before a diagnosis is made. The pain typically affects multiple joints, symmetrically, meaning both hands, both knees, or both ankles at the same time. Unlike osteoarthritis, which gets worse with activity, autoimmune joint pain often improves as you move throughout the day. But that morning stiffness is a telltale sign. If you're experiencing joint pain that lasts longer than 6 weeks, especially with morning stiffness exceeding 1 hour, your immune system might be attacking your joints. Early detection and treatment can prevent permanent joint damage, so this is one warning sign you cannot afford to dismiss. Next, sign 3, persistent low-grade fever. Here's a symptom that puzzles many people, a fever that won't go away. Not a high fever that signals an obvious infection, but a persistent low-grade fever hovering between 99 and 101 degrees Fahrenheit. This subtle elevation in body temperature is your immune system's way of announcing that something is wrong. When your immune system attacks healthy tissues, it doesn't do so silently. It releases inflammatory molecules called cytokines, including interleukin-1 and tumor necrosis factor, which act on your hypothalamus, the part of your brain that regulates body temperature. Research published in The Lancet Immunology in 2024 highlights that these persistent low-grade fevers often appear before other autoimmune symptoms become obvious. This makes fever one of the earliest warning signs your body can give you. Many people dismiss this symptom thinking they're fighting off a cold or virus. They wait for other symptoms to appear, but by then, the autoimmune process may have already caused significant damage. What makes this fever particularly concerning is its persistence. It doesn't respond to typical fever reducers the way an infection-related fever would. It comes and goes without an obvious pattern, and it's often accompanied by general malaise or feeling unwell. If you've had an unexplained low-grade fever for more than 2 weeks, especially without any signs of infection, your immune system might be misfiring. This is your body's early distress signal, and it deserves medical attention. Next, sign 4. Skin rashes and butterfly-shaped rash on cheeks. Your skin is often the first place autoimmune diseases make themselves visible. One of the most distinctive and alarming signs is the butterfly-shaped rash that appears across the cheeks and bridge of the nose. This is the classic hallmark of systemic lupus erythematosus, commonly known as lupus. But autoimmune skin manifestations go far beyond this iconic butterfly rash. People with autoimmune diseases can develop various skin problems, including red, scaly patches, hives, or areas of skin that become lighter or darker than normal. What's particularly significant about the lupus butterfly rash is its photosensitivity. Research shows that approximately 70% of lupus patients experience worsening of their rash when exposed to sunlight or ultraviolet light. This happens because UV radiation triggers an immune response in people with lupus, causing skin cells to die and release their contents. The immune system then reacts to these cellular contents as foreign invaders, creating inflammation and the characteristic rash. Studies in the Journal of the American Academy of Dermatology document that skin involvement in autoimmune diseases isn't just cosmetic. These rashes are visible evidence of systemic inflammation happening throughout your entire body. The skin changes you see on the surface reflect the autoimmune battle raging inside. If you notice persistent rashes, especially a butterfly-shaped pattern on your face that worsens with sun exposure, or any unusual skin changes that don't heal, your immune system might be attacking your skin cells. This visible warning sign should prompt immediate medical evaluation. Next, sign 5. Unexplained weight loss or weight gain. Your weight shouldn't fluctuate dramatically without a clear reason. But when your immune system attacks your thyroid gland, your metabolism goes haywire, leading to sudden and unexplained changes in your weight. This is particularly common in autoimmune thyroid disorders like Hashimoto's disease and Graves' disease. Here's what's happening inside your body. Your thyroid gland produces hormones that control your metabolism, the rate at which your body burns calories and uses energy. When autoantibodies attack your thyroid, they disrupt normal hormone production. In Hashimoto's disease, the thyroid becomes underactive, producing too little thyroid hormone. This slows your metabolism, causing weight gain despite eating the same amount of food or even eating less. Conversely, in Graves' disease, the thyroid becomes overactive, producing excessive thyroid hormone. This speeds up your metabolism dramatically, causing rapid weight loss even when you're eating normally or more than usual. The American Thyroid Association reports that sudden weight changes are among the most noticeable symptoms in both conditions, often prompting people to seek medical attention. But weight changes aren't limited to thyroid disorders. Other autoimmune conditions can also affect your weight through different mechanisms. Inflammatory bowel diseases like Crohn's disease can cause weight loss due to malabsorption of nutrients. Some autoimmune conditions cause weight gain through medication side effects or reduced physical activity due to pain and fatigue. If you've experienced unexplained weight changes of more than 10 pounds in a short period without changes to your diet or exercise routine, especially when accompanied by other symptoms like fatigue, temperature sensitivity, or changes in heart rate, your immune system might be under autoimmune attack. Next, sign 6. Digestive issues, bloating, diarrhea, or abdominal pain. Your digestive system is more than just a food processing plant. It's home to approximately 70% of your immune system, which means it's also a common target for autoimmune attacks. Persistent digestive problems like chronic bloating, diarrhea, constipation, or abdominal pain could be signs that your immune system is damaging your intestinal lining. Celiac disease and Crohn's disease are prime examples of autoimmune conditions that directly attack the digestive tract. In celiac disease, consuming gluten triggers an immune response that damages the small intestine's lining, specifically the villi, tiny finger-like projections that absorb nutrients. Research on these conditions shows that the autoimmune attack causes inflammation that disrupts the intestinal barrier, leading to what scientists call increased intestinal permeability. This damage interferes with nutrient absorption, causing deficiencies in iron, calcium, vitamin D, and B vitamins, even when you're eating a healthy diet. In Crohn's disease, the immune system attacks the entire digestive tract, from mouth to anus, causing deep inflammation that can lead to ulcers, strictures, and fistulas. Studies published in gastroenterology demonstrate that early autoimmune damage to the intestinal lining often presents with nonspecific symptoms like bloating, cramping, and irregular bowel movements. Many people suffer for years, trying various diets and over-the-counter remedies before receiving an accurate diagnosis. The key distinguishing factor is persistence. These symptoms don't resolve on their own and often worsen over time. If you're experiencing chronic digestive issues lasting more than 4 weeks, particularly with blood in your stool, unexplained weight loss, or severe abdominal pain, your immune system might be attacking your digestive tract. Early diagnosis and treatment are crucial to prevent permanent intestinal damage and serious complications. Next, sign 7. Hair loss or bald patches. Losing your hair can be emotionally devastating, but when it happens in circular patches or affects large areas suddenly, it might be more than just stress or aging. Alopecia areata is an autoimmune condition where your immune system attacks your hair follicles, the tiny organs in your skin that produce hair. But hair loss isn't exclusive to alopecia areata. It's also common in lupus, thyroid diseases, and other autoimmune conditions. Here's the mechanism behind autoimmune hair loss. Your hair follicles go through natural growth cycles, but they're normally protected from immune system attacks by what scientists call immune privilege. In autoimmune diseases, this protection breaks down. T cells, a type of white blood cell, mistakenly identify hair follicle cells as foreign threats and attack them. The Journal of Autoimmunity reports that autoimmune-related hair loss can manifest in different patterns depending on the underlying condition. In alopecia areata, you typically see smooth, round bald patches that can appear anywhere on the scalp or body. In lupus, hair loss is often more diffuse and may occur along the hairline, creating what's called lupus hair with short, broken hairs around the forehead. Thyroid-related hair loss tends to be more generalized thinning across the entire scalp. What makes autoimmune hair loss particularly distressing is its unpredictability. Hair can fall out suddenly and regrow spontaneously, or it may progress to complete baldness. Research shows that hair loss often correlates with disease activity, meaning when the autoimmune condition is more active, hair loss worsens. If you're experiencing sudden hair loss, especially in patches, or if your hair loss is accompanied by other symptoms like fatigue, joint pain, or skin rashes, your immune system might be attacking your hair follicles. While emotionally challenging, recognizing this as a potential autoimmune sign can lead to proper diagnosis and treatment of the underlying condition. Next, sign 8: numbness, tingling, or muscle weakness. Imagine feeling pins and needles in your hands and feet, or suddenly finding it difficult to grip objects or climb stairs. These neurological symptoms might seem minor at first, but they could indicate that your immune system is attacking your nervous system. This is particularly common in multiple sclerosis and Guillain-Barré syndrome. In multiple sclerosis, the immune system attacks myelin, the protective coating around nerve fibers in your brain and spinal cord. Think of myelin like the insulation around electrical wires. When it's damaged, nerve signals can't travel properly, causing a wide range of neurological symptoms. You might experience numbness, tingling, weakness, vision problems, balance issues, or cognitive difficulties. Guillain-Barré syndrome works differently but is equally serious. The immune system attacks the peripheral nerves that connect your brain and spinal cord to the rest of your body. This typically starts with weakness and tingling in the legs and can progress upward, sometimes leading to paralysis if not treated promptly. Research published in Neurology journal identifies these neurological symptoms as among the earliest clues to autoimmune nervous system involvement. The challenge is that these symptoms can be subtle and intermittent at first, making them easy to dismiss. You might attribute numbness to sleeping in an awkward position, or weakness to simply being out of shape. But autoimmune neurological symptoms tend to worsen over time, or occur in episodes separated by periods of recovery. What sets autoimmune neurological symptoms apart is their pattern and progression. They often affect both sides of the body, though not always symmetrically. They may worsen with heat or physical activity and improve with rest. If you're experiencing persistent or recurring numbness, tingling, weakness, or coordination problems, especially if they're progressing or accompanied by other symptoms, your nervous system might be under autoimmune attack. Neurological damage can become permanent if not addressed quickly, making early medical evaluation absolutely critical. Next, sign 9: organ damage, kidney, liver, lungs, or heart. This is where autoimmune diseases become life-threatening. When your immune system attacks major organs, the consequences can be devastating and potentially fatal. Organ involvement represents advanced autoimmune disease and requires immediate medical intervention. Let's focus on lupus as an example, though many autoimmune diseases can affect organs. Lupus nephritis, or kidney inflammation caused by lupus, affects up to 60% of lupus patients, according to research published in the New England Journal of Medicine. The immune system attacks the tiny filtering units in your kidneys called glomeruli. These filters are responsible for removing waste from your blood while keeping essential proteins and blood cells in your circulation. When autoimmune inflammation damages these filters, proteins leak into your urine, waste products build up in your blood, and kidney function progressively declines. Without treatment, this can lead to complete kidney failure, requiring dialysis or transplantation. But kidneys aren't the only organs at risk. Autoimmune diseases can attack your heart, causing inflammation of the heart muscle, pericardium, or blood vessels, increasing your risk of heart attacks and heart failure. Your lungs can develop inflammation, leading to scarring and breathing difficulties. Your liver can be attacked in conditions like autoimmune hepatitis, causing progressive liver damage and potential liver failure. The frightening reality is that organ damage often occurs silently. You might not feel symptoms until significant damage has already occurred. This is why regular monitoring is crucial for anyone diagnosed with an autoimmune disease. Blood tests, urine tests, and imaging studies can detect early organ involvement before you feel sick. If you have an autoimmune disease and experience symptoms like swelling in your legs, decreased urine output, shortness of breath, chest pain, or yellowing of your skin and eyes, these could indicate organ involvement requiring emergency medical attention. Organ damage represents the most serious complication of autoimmune diseases, but with early detection and aggressive treatment, progression can often be slowed or even reversed. We've just walked through 9 dangerous signs of autoimmune diseases, each one backed by scientific research and clinical evidence. From unexplained fatigue and joint pain to organ damage, these symptoms are your body's way of crying out for help. Autoimmune diseases affect millions of people worldwide, and early detection can make the difference between managing a chronic condition and facing life-threatening complications. If you recognized several of these symptoms in yourself or a loved one, don't panic, but don't ignore them either. Schedule an appointment with your healthcare provider and discuss your concerns. Bring a list of your symptoms, when they started, and how they affect your daily life. Autoimmune diseases can be complex to diagnose, but awareness is the first step towards getting the help you need. Remember, your health is your most valuable asset, and you are your own best advocate. If this video provided valuable information, please type "helpful" in the comments below. Your feedback motivates us to create more evidence-based health content like this. If you found this information useful, please hit that like button, share this video with someone who needs to see it, and subscribe to our channel for more health insights that could change your life. Thank you so much for watching and for taking your health seriously. Until next time, stay informed and stay healthy.